Hello everybody, welcome back. I would like to talk to you today about probably what is my favorite procedure, a facelift. In the plastic surgery world, facelift probably represents the most technical procedure we can do as the margin of error is almost zero. Facelift is a great procedure. It's been done for a long time, has been refined more and more over the years. This is what I did as a fellow when I graduated from U of T in plastic surgery. I went to Paris and Los Angeles, a bit of New York City, where I subspecialized in learning different techniques of facelift surgery. Now, Visage, which is the name of my clinic, means face. It also refers in the Old English, actually, the whole appearance of a person. And that's, that's a long story, but this is where the word visage came from my practice. Also because facelift is my little baby in plastic surgery. So there are many, many different types of facelift, and over the years, various surgeons have used different terms and trademarked procedures a little bit to entice patients with new words, making them believe that everything is new or this is the newest. But ultimately, a facelift refers to redraping soft tissue, repositioning the soft tissues, pulling a deep layer of muscles, and having the most hidden scars in the face. Now, there are no accepted terms for all the techniques. The newer terms technique, which is not so new, is what we call the deep plane facelift. It's been done for a long, long time. It always refers to doing a dissection under the muscle layer being called the SMAS layer, which is an old term from the 1980s, but has been kept all along the years. And now the deep plane facelift is a combination of a dissection under the muscle and a lesser dissection under the skin so that we get a better scar around the ear. Now, in my practice, I chose to divide the face into 4 parts. So I talk about the neck, I talk about the lower face, I talk about the mid face, and the upper face or the brow. With aging, the vectors of forces with gravity and aging are forward and down. So when we want to rejuvenate a face, we have to do the opposite, go up and back. So when we want to address the neck, we have to go behind the ear. When we want to address the lower face, it's in front of the ear, going up towards the sideburn. To lift the cheek or the so-called mid-face, we have to go somewhere in the temporal region, and the brow is above here. In the 80s and 90s, a full facelift was all of this. Today, we tend to refer to a facelift as a lower face, at least in North America, which is neck and lower face. When we start with the neck, we have a muscle in the neck called the platysma. That's the one that helps us to do this. It's a thin muscle attached to the lips, and it goes in the mid-neck here and goes all the way to the collarbone. It's a thin muscle, webbing kind of muscle that in the 30s starts to detach in the midline, and then in the 40s and up, it starts hanging down. So the so-called turtleneck, turkey neck, chicken neck is usually a muscle band that's loose, which is compounded by excessive skin. So a primary first thing to be done in a facelift, in my hand, and for most plastic surgeons, would be to repair the muscle here. There's a small incision under the chin. We plicate or repair the muscle. We call it a platysmoplasty. We can remove deeper tissues, deeper fat. We can try to suspend the submandibular glands. We can remove fat under the platysma for thick, heavy neck. There are a lot of things we can do from this incision. And more importantly, we can also put a nice chin implants that will often complement a facelift in both male and female. And we have different implants for male and females. But it also, with the little wings that our chin implants have, helps to fill that little divot that even with a facelift, patient will keep or will appear quickly post-surgery. So I love chin implants. We use it in about 90% of our facelift here. So platysmoplasty. And I find it important to mention this because in the ear, nose, and throat population, our colleagues in the ear, nose, and throat field, most of them don't believe in repairing the muscle. So they only pull on the muscle here, which brings the loose bands here. And 5 years later, they're too far for me to repair. So we just keep pulling, opening this area here. So for me, it's crucial to repair this. And then when we do the deep plane facelift, we pull on that muscle, it's repaired here, and now it becomes like a hammock. It's a very powerful maneuver to give a very crisp and sharp 90-degree angle in the neck. Now, this is the neck lift. The lower face is for the jaw and to some extent the marionette lines. We do a skin lift. We pull on the muscle too. The muscle can be manipulated in many ways. It can be cut in 1, 2, or 3 flaps where we can have different vectors of pull. It can be plicated also as done in the so-called MAC facelift. Now, when we extend into the temporal region, I like obviously to hide the scar in the temple to lift the cheeks. However, if our patient, so some ladies in all secondary facelift and for all men, the sideburns are high and we cannot just continue straight into the temporal line for fear to raise up and back the sideburn, which would age our patient sideways, which we don't like to do in most cases. So what we do in those patients, so about 50% of our ladies, all second facelift and most males, we do what we call, or the Brazilians call, the peninsula technique, where we go in front, underneath, and in front of the sideburn, and we go back into the temple. Going in front of the sideburn, the skin is removed in front here, and the sideburn is a peninsula, stays stable, stays youthful. So it's very important to make a very good scar, hence the strong pull on the muscle, which can bear tension, but a very minimal pull on the skin, so we get a beautiful scar, which almost disappears over time. And the trichophytic technique is a way to cut through hair follicles to allow hair to grow back into the scar over 6 to 12 months. So that's the mid facelift. And for our patient who desire a full facelift, where either they have a high forehead, we need to shorten the forehead, or they have a low brow, we want to raise the brow. The brow lift can be done in about 3 versions, but the main one being the incision is carried from one side to the other in the scalp, hair-bearing scalp, where we will pull from here, but that will raise the hairline up a little bit. So if a lady has a healthy low hairline, it's good. If our lady or men have a high forehead line, then we have to follow the hairline, trichophytic incision, so that we don't raise the hairline, and if anything, we can bring the scalp forward to lower the hairline. That is the so-called full facelift. Now, all those procedures can be combined with fat grafting. Fat grafting is a great addition to a facelift. It does add a little bit of time of recovery with bruising and swelling, but for most of our patients who do fillers on a regular basis, it's a great way to minimize the need of filler over time by doing fat grafting. And if I do fat grafting in a facelift, I usually inject in many places. I will go in the temple, usually done from inside when the skin is open. We will do under the eye for the hollow of the eyes. We do cheeks, we do nasolabial fold, we do marionette line, jawline contouring. I'll do chin if we're not using a chin implant, and we often do lips on our ladies. That can also be combined with upper eyelid surgery, which is a common, relatively efficient time-wise in surgery that can be added. Now, I like to keep my patients overnight, especially when we're doing a compound kind of facelift with fat grafting and maybe the mid or the full facelift. I like to keep them overnight, somewhat for customer service, but also for nursing care. We use drains commonly for just 12 hours for the overnight stay. We like to pamper them in our overnight stays. We have 2 beautiful rooms, 2 nurses who will stay with our patients. We help them, supply them for nice dinners and nice breakfast as well. It allows me to see them early in the morning the next day and to send them home with all the good post-op instructions. So again, facelift, the so-called deep plane facelift, is a very common procedure we do here at Visage Clinic, which means face. Thank you for watching. Have a lovely day. Dr. Mark DuPéré's in Toronto.